Hello everybody and welcome to the Tuesday edition of Video Clips, and I will start with some announcements. First of all, free stuff that's going on. On September 8th, I can't believe we're already talking about September already, is our next dinner here at Wellness Farm Health. So if you're watching this from New Zealand, you're probably thinking, well, why are you telling me about this? Well, we now have this fabulous Ustream thing where you can actually email me and we'll get you signed up to watch it on Ustream. So the lecture is great, there's Q&A, you can even ask questions via email. The only thing we can't do is feed you, and I'm so sorry about that, but you can participate in the discussion. So if you've never watched one of those, I strongly encourage you to do it. It's at 6 p.m. Eastern on September 8th. And then you could spend the whole evening with us, because at 9 o'clock that night, I'm doing a conference call, and I will record it in case you're not available that night, on green tea and cancer. Why am I doing this? I've always said there are no magical foods. However, there is a lot of research about green tea and its effect on cancer. And I could talk about it for a long time here, but that's what I'm going to talk about. I think you'll be very interested in what I have to say. I mean, there are 1,800 articles, over 1,800 articles in medical journals about one nutrient in green tea and cancer. Tens of thousands about green tea and cancer and other diseases too, but I just want to focus on the cancer connection. So those are free things that you can participate in. Second thing is on September 9th and 10th, I'm doing what's called an informed boot camp. It's a Friday night for 2 hours, Saturday afternoon for 3 hours. And what we're going to look at, if people do not know how to read their blood test results, and they also don't understand what reference ranges are, what is a healthy blood glucose level? It differs from lab to lab. How do you know? What should your A1C be? What should your blood pressure be? Some people say ultra low. Some people say don't worry. We're going to go through all that stuff. We're going to talk about how to find doctors, questions to answer, doctors, therapists, other healthcare providers. And we're going to talk about how to read research. A lot of people would like to know how to be a little bit more self-sufficient in that area. I promise you can learn. So that's on the 9th and 10th. And then the last thing, fall semester at Wellness Farm Institute starts next week. Diet and Lifestyle Intervention program will be offered. And then Microbiology 2, Chemistry 1, Autoimmune Diseases, Cardiovascular Diseases, Food Preparation. These are all part of the Nutrition Educator program. If you're interested in earning a diploma in nutrition, this is the best one in the country. I know I'm a little biased when I tell you that, but I really believe it's one of the best ones, if not the best in the country. Or you can just take one class that you're interested in. So if you want information about any of this stuff, just email me at pampopper@msn.com. Oh, one last thing I have to mention. If you are a woman, sorry guys, we have something coming for you very soon. Any place in the United States, and you want to start a Healthy Girlfriend chapter, Operation Healthy Girlfriend. My good friend and colleague, Dr. Lana Contos, this is her brainchild. It's fabulous. We'll show you how to start a group, how to make it profitable, how to help a lot of other women like you do better at a lot of things, including health. So if you want to talk about that, send me an email. All right, topic number 1. How much salt is too much? How much is too little? Questions that are debated all the time. Growing body of research is showing that consuming too much salt and too little salt is bad for health. According to some health professionals, there's no such thing as too little salt, and some say none is the best. As for how much is too much, there's a whole lot of debate about that topic, with organizations like the American Heart Association saying that anything over 1,500 milligrams is too much, and some groups saying anything over 600 milligrams is too much. Now, I've always said that advice needs to be tailored to the person. And the study that I'm going to talk about is important because some professionals, like me, have hypothesized that the association between sodium intake and cardiovascular disease and mortality is related to whether or not people have hypertension. To examine the issue, a group of researchers looked at over 133,000 people, some with, some without hypertension. The subjects were an average of 55 years old. They came from 49 different countries. 24-hour sodium excretion, urinary sodium excretion, was used to estimate salt intake, and then the researchers looked at that and the relationship between this and their blood pressure, cardiovascular disease, and death. The low sodium group consisted of people with less than 3,000 milligrams of sodium in their urine, high sodium group 7,000 milligrams. When compared with moderate sodium intake, high sodium intake was associated with an increased risk of cardiovascular events and deaths in patients with hypertension. There was no such association in the subjects who did not have hypertension. But low sodium intake was also associated with increased risk of cardiovascular events and death in both the subjects with hypertension and those who didn't have it. Restricting dietary sodium to under 3,000 milligrams a day had the same effect on increasing the risk of cardiovascular disease and death as eating too much salt for hypertensive patients. Eating a low-salt diet increased the risk of heart attack and stroke 26% for those without hypertension, 34% for those with hypertension. Eating too much salt increased the risk of heart attack or stroke by 23% of people with hypertension, and not at all for people who didn't have hypertension. So even all the hypertensive patients were experiencing the same result. When making dietary recommendations to others, I think it is important to keep in mind several things. One is that not all recommendations are appropriate for all people. And this goes to a lot of things. I mean, alcoholics should abstain from alcohol, but having a lecture about alcohol for somebody who's otherwise healthy and has 6 cocktails a year is overkill. One-size-fits-all recommendations plague all aspects of the medical field. I mean, everybody should take vitamin D. All women should have a mammogram. All people should take a daily aspirin. These are examples of gross generalizations that don't apply to everybody. Well, you can be guilty of the same thing in the diet business, and this idea that everybody should salt restrict is an example. Then another thing that we have to consider is every restriction that we add to the list of things we tell people to do makes it harder to get them to stay compliant on an optimal diet. Eating a perfect diet for a few days, a few weeks, or a few months and quitting doesn't help. Eating a less than perfect but extremely improved diet for the rest of one's life does. So I think we have to focus on the right things, getting people to eat the right foods instead of the things that don't make a difference or can actually harm some people. So I have said for a long time, there is no question that there are people who should salt restrict. Think about people who hold water, they retain water when they eat salt. Think about people who do have hypertension and it gets worse as a result of salt intake. But that isn't everybody, and so let's not tell everybody the same thing. All right, here's another news story I want to cover. A new drug called abaloparatide is touted as being better, air quotes around that, for patients with osteoporosis, according to a new article in the Journal of the American Medical Association. It's expected that the drug will be approved by the FDA based on the results of a large, air quotes around that, clinical trial. And so this is just the latest in a whole string of useless tests and treatments for osteoporosis and bone health. I mean, DEXA scans are used to diagnose osteoporosis, and it's pre-disease. Have you noticed everything's got a pre? I talked about pre-diabetes last week. Osteopenia. The scans are useless, diagnosing mostly women with loss of bone mineral density, which is a normal marker for aging. But based on the results of these silly tests, drugs are prescribed. Bisphosphonate drugs are usually the first line of treatment. And the drugs are supposed to slow bone loss, but they're so useless and harmful, causing side effects like osteonecrosis of the jaw and spontaneous fracture of the femur, that 80% of people who are hospitalized with a fracture refuse to take them, all right? Now, there's another whole class of drugs. Forteo is the biggest one. It's an injectable drug made by Eli Lilly. It's very expensive, $2,250 for a 4-week supply. And what this drug does is supposedly stimulate bone loss and bone building, supposedly with net bone gain. And so this new drug is a competitor to Forteo, and Forteo has some serious side effects, which I'll come back to in a minute. So the clinical trial, this big clinical trial that they talked about, compared the new drug with both Forteo and placebo. As has become common practice, reports of benefits were grossly exaggerated. Now, rattling off a bunch of numbers in this setting when I'm talking to you like this, I'm not going to do that, but I'll just cut to the chase and give you the results here, and you can read the article, by the way. I post these in the HealthBrace library. They're posted by the time you see this video. But in any case, the new drug resulted in a 0.26% reduction in fracture risk when compared to Forteo. 3.64% risk reduction compared to placebo. I mean, that's hardly much to get excited about, especially when considering that the researchers actually said this. The study was not large enough to determine if the drug really reduced the risk of fractures at all. So why are we talking about it? Nonetheless, Radius, the maker of the drug, has asked the FDA for approval, and they're certain it'll be granted. And it probably will, because the FDA approves 94% of all drugs that are submitted for approval or older drugs for a new purpose. Side effects of the new drug are not well known at this time, but the side effects of Forteo are quite concerning. Patients can only take the drug for 2 years, since it's been shown to increase the risk of bone cancer in animal studies. In fact, the FDA requires a warning label concerning this side effect, and insurance companies generally only pay for 2 years of treatment. And then patients are transitioned to a bisphosphonate drug for maintenance. So bottom line is that the whole, Dr. McDougall calls it the broken bone business. I call it the fraud and dishonesty business. I mean, it doesn't matter what you call it. This whole thing is just ridiculous. The drugs are useless, and they're treating a disease that most of the time is not even real. So I have no enthusiasm for bisphosphonate drugs, for Forteo, or for this new drug. But as I said, I'm pretty sure it'll be approved, because the FDA pretty much lets the drug companies do whatever they want to do. All right, that's all for today. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you on Thursday with more news.